So we've mentioned a number of issues. I'm wondering if I'd like to ask each of you to look into your own personal crystal ball and tell me, if you will, what you are anticipating in the coming year and what you're expecting to see or to learn next year at AHA scientific sessions.
Well, I think that that in terms of our support for basic translational, clinical, and population science, it's as strong as ever. I think that we are in no way should we neglect our tremendous heritage in basic research to sort of get more population research done. I think we need to do more of everything, but I think we need to be focusing more. I'd like to see more good, solid population science at this meeting. Focus on prevention, epidemiology, population issues, and so on. I think that's really important. I think that the Heart Association has moved even more aggressively, is continuing to move toward a standard of evidence-based whenever possible, and I think that our peer review process continues to be very strong, and I think that continues to be a focus. I think that we still have lots to sort out in one of our most important areas of treatment, which is percutaneous coronary interventions. I think that there have been some important studies. The COURAGE trial was very important. The issues related to different kinds of stents, we don't have all the studies that we need to sort of sort this out. And I think that certainly is an important area that continues to need attention and resolution. And I would expect more dealing with PCI issues in this next year.
Let me ask you about just specific, before I go to Dr. Gibbons, in terms of that PCI. I had heard that the Heart Association was considering having a sort of special section or session concurrent with scientific sessions that would just be specific to PCI. This is something that the American College of Cardiology does, and there were many rumors in the last year that I've heard that the AHA was actively pursuing that venue as well.
We have tried to have lots of interventional cardiology content in our meeting, and in fact we do. We have the major Sunday morning program is Bench to Bedside and Interventional Cardiology, and we have an interventional cardiology track. So I'm not sure what you're hearing or the source of it, but I think that the program committee will continue to put as much emphasis on interventional cardiology and related issues as is warranted by the number of abstract submissions submitted, plus by the importance of the field in terms of clinical cardiology. So there's plenty of interventional cardiology in a meeting now, and I think we will continue to see that. You want to add something to that?
I think the whole issue of little meetings and separate meetings, we would offer the perspective that one of the strengths of this meeting is that all those different groups are at the same place. And it's reflected in the translational science that takes place here. I think it's also reflected in the interaction about how to best take care of patients, not with this procedure or that imaging procedure or this, but as a system. And we're going to have to be more efficient as a system. So I think that interaction is imperative and remains imperative. We can't be separated into a whole bunch of little silos. It just fuels inefficiency in our healthcare system. In terms of, I agree with the things that Tim's already said. To just build on that, we mentioned the whole issue that the AHA is involved with Mission Lifeline. We had a presentation of what's called the RACE study here from North Carolina. There are a number of initiatives underway already around the country to improve the delivery of care to patients with acute coronary syndromes, in particular ST elevation MI. And I think we're going to see a lot more reports of those ongoing about the whole issue of how you get ECGs done in the ambulance, read in the ambulance, what systems are available to do that. This is not a one-size-fits-all for our country. There are too many different geographical barriers, population density barriers that come into play, and I think we're going to see a lot more reports about better delivery of that kind of effective reperfusion therapy to a higher percentage of our population. So it's about better implementation of the things that we know on a broader basis. And I think we're going to see, moving forward, a lot more study of that kind of issue, because I think everyone's come to realize we think we're all doing a good job, but when you look at the big picture from larger registries, we're missing people.
Just a final word from either of you? Any final thoughts on Scientific Sessions 2007?
The problems in health are international. The theme that our president struck this year about reducing healthcare disparities apply within our country, they apply around the world, and that's why people gather from around the world for scientific sessions.
Dr. Gardner?
I think it was a very successful meeting, a very vigorous and strong scientific agenda. I think we look forward to, I think it's as strong as ever, and we look forward to this format continuing, and we expect to see an equally strong meeting next year with lots of international attendees.
Thank you, Dr. Gardner. Dr. Gibbons, pleasure as always. Thanks, Don. From Orlando, at the American Heart Association Scientific Sessions 2007, for MedPage Today, this is Peggy Peck.